Hello again. We talked a little bit on the general physical exam or the routine checks for 2023. I thought I will continue the same a little bit more. The two topics that come to my mind and people are interested is checking the PSA, which is prostate specific antigen, PSA, prostate P, specific S, antigen A, in males for diagnosis of prostate cancer. And the second one is a mammogram, which is for breast cancer detection in females. I'll start with PSA, and then if I have enough time, I will do the mammogram this time or maybe next time. The question that I often get is, don't you have any test that can detect a cancer? And unfortunately, none is very specific unless you're looking for a specific cancer. So the certain blood tests, which are routinely done by oncologists, is nothing more than doing a blood count, etc. But specifically for cancer detection, there are no specific blood tests. There is an old one called CEA. CEA was detected early for colon cancer, and then it is also elevated in many other cancers, including lung cancer. So if it is markedly elevated, certainly there is a possibility of either colon or lung cancer, but they're not specific for that. So any cancer can elevate CEA. There are specific blood tests for pancreatic cancer. And if somebody is suspecting pancreatic cancer, those could be done, but routinely they're not done as screening blood tests. So as a screening or routinely performed blood test, there are very few, and the only one that is absolutely done, recommended nationally and internationally, is PSA. So the CEA and the other ones for specific cancers are not routinely done and do not have any routine value to detect early cancer of a specific organ. So coming back to PSA, prostate specific antigen, this is a one that is done in men. The question always comes in that what is the sensitivity and what is the specificity, which simply means that if it is done and it is abnormal, how much does it pick the cancers and how specific it is for that particular diagnosis. So sensitivity means how many times it picks up cancers when there is a cancer. Specificity means when there is an abnormality, it is specific for that cancer. So unfortunately, even PSA is not guaranteed to be sensitive or specific, but there are guidelines which are established. So a PSA is done, as the name itself means, prostate specific antigen, is done after the age 40. 40 to 50 is done only if there are certain conditions which is high risk population, then only it is done. It is not done routinely till age 50. So a PSA should be done routinely in men over 50. So between 50 to 70, or some people say 50 to 74, PSA should be done routinely. The problem after 74 is, and again, I'm sure this will change, and it's already changing, is that people feel that diagnosing prostate cancer, say, in somebody who has no symptoms at age 80 has not much of value for treatment or for prognosis. So if somebody has a metastatic prostate cancer at age 80, following PSA is absolutely essential. However, A routine screening when the life expectancy may be less than 10 years is not recommended. So that is the reason people are not doing it less than 50, because the sensitivity and specificity is very low, and 50 to 74 is the age group of men when PSA should be checked. Number two is that certain medicines interfere with detection of PSA. Things that are taken like finasteride, which is or somebody who has had prostate exams, somebody who has benign enlargement of the prostate with urinary retention, somebody has, say, renal or kidney stone, had some urological procedure done. These things will interfere with measurement of the PSA, and they will give you false results. So some of the drugs like finasteride would reduce the PSA. Some of the intervention like inflammation or infection of prostate, urinary retention, or urinary intervention like stone removal, etc., will increase the PSA falsely. So if that has been done, then avoid doing PSA at that time. The values less than 4 are considered normal. Again, how often do you do it? Most of the people recommend every 2 years, not every year, but in a high-risk patient, it could be done every year. As you can imagine, breast cancer gene 1 and 2, BRCA1 and 2, can increase incidence of prostate cancer in men. Subsequently, if somebody has that gene mutation, then they should do it every year starting in age 40s. Again, 74 is not hard and fast, but because of the cost effectiveness of the diagnosis and the treatment aspects, they are not recommending doing it over 75 unless there is a specific reason to do it. Values less than 4 are considered normal. 4 to 7 is a gray area. It is definitely abnormal, so it should be repeated in 6 to 8 weeks. If the value continues to be elevated more than 4, then person should be referred to urologist for further examination, biopsies, tests, etc. Values above 7 should always be sent to urologist. So 7 plus, send to urologist. 4 to 7, repeat. If continues to be elevated, send to urologist. The caveat that I was going to talk about was that if somebody is on, say, finasteride, which is a drug used for prostate, and the values are monitored, as I said, the drug can reduce the PSA. So you can have a prostate cancer, but you may have a falsely low report. If there is an elevation or increase between the two collected PSAs of more than 0.5, so let's say somebody had PSA of 3.5, you repeat it, and while on finasteride, it goes to 4 or say 4.2. You must consider that as a positive or elevated PSA and send that person to urologist. So as I was telling you, the PSA should be done between the ages of 50 to 74. As the average life expectancy will continue to rise, this may change. It should be done at least once or every 2 years. In some high-risk patient, it should be done yearly. Those people who have some family member or family history of prostate cancer or have a gene mutation like BRCA1 should have PSA checked after age 40, and abnormal values, depending upon the value, should be either repeated if between 4 to 7, if more than 7, so should be sent to a urologist. Prostate cancer can spread to the bones and has some mortality subsequently, unless somebody has a lifespan expectancy more than 10 years. It is not routinely recommended after age 75. We'll talk about mammogram next time. Thank you for watching. If you like it, please subscribe. Have a nice day.